All, this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. So, this show is earlier today because I have another task that I need to do in the evening. Um, Also, this one case report that I would have is a really interesting situation. So, let me give you a couple of cases that I encountered today. So, while discussing this, let me also provide the disclosure up front. I do not practice in the US. So, this is not the case report of my practice, but instead a, a an educational guidance or educational discussion with two patients and the outcomes. This morning, I spoke with a, a COVID injured patient, just like we say vaccine injured. She had COVID from Wuhan variant, so earlier when the COVID started, and has been suffering since then. And most of the approaches, she has neurological symptoms and blood vascular symptoms. Most of the approach that doctors have taken are trying to give them um, anti-epileptics or just simply nothing, saying we do not see much in the blood. So I presented a few possibilities to discuss with the doctors. And as that was, I was thinking about that. I always think about when I see patients suffering for so long. I received an email from another patient here in the US, and I wanted to share with you how this particular email went. So I'm not going to disclose the name. So I'm going to read out some of the email communications. This is January 5, 2023. This patient's partner reached out to a university's professor and mentioned to them that we live in this particular place, and then we have a good friend, Mark. I'm changing the name, Mark, who is in the copy, and they have been suffering, Mark has been suffering from debilitating and steadily worsening health problems soon after receiving COVID booster shot in April 2022. This problem include near constant migraine, profound fatigue, vestibular problems, inability to process sensory input, and as a consequence of these, Mark has confined himself to darkened room, cannot work. He is a very popular artist, cannot work, read, or undertake most functions of daily living, and has grown increasingly weak. They have been, and now I'm just paraphrasing the remaining long email, they have been to Mayo Clinic, where, and then neurology clinic there. Doctors have not been able to diagnose or prescribe, and the drugs that they prescribed, I'll show you, they have not worked. Mark never had any COVID infection. So the first patient I discussed who's suffering with long COVID had COVID infection. This patient did not have COVID but had booster. So they then reach out, then they mentioned that we have seen to that professor, we have seen your work, and maybe you can be of help. That professor connected them to me, saying Mubin has been presenting these topics for a very long time and he is very well read on this. So maybe he can help you connect with the right doctors and explain what's going on. So I had a number of interactions with them. Then I spoke with them as well. And in that process, of course, I think that many of you have seen the FLCCC protocols. One medication that I am a big fan of, especially for the neurological symptoms, is low dose naltrexone. Now, it is not necessary that low dose naltrexone works for everyone. It really is, some patients really marvelously and magically, miraculously respond to it, some don't. My own wife responded to it very well. So, I had a meeting with them over Zoom, and there are some more communications, but I want to share how that went. In that Zoom meeting, Mark joined briefly and just abruptly got up and went. And it turned out that he cannot stay upright for more than a few minutes. Not only he is in a dark room, he has to stay lying down. And Mark is a very popular artist, a teacher. Imagine for a person, any person, not just an artist or a teacher, for any person who is doing their normal, regular day to day tasks, and all of a sudden they're confined to a dark room and there is no further hope. I cannot imagine the what goes through the minds of such patients. So then we had this meeting. Mark abruptly went and lied down. His partner continued to speak with me. And here is a very quick look at the journey Mark had. So, just a very quick one here. I've made sure that I scrubbed anything that may be pointing to the person, but this is the physical ability, sensory processing ability, hospitalizations, and here is the time frame. And as you can see, there is a continuous deterioration. And as you can see, this is the booster, and then here the person actually had the first visit. Then they received steroid pack, which I actually believe that vaccine injury or COVID, long COVID, there is a value in starting with steroids to kind of halt the inflammatory process while you get your ducks in the row. I'm talking about doctors to figure out how to manage this patient. So then they were given uh, anti-epileptics. So here is topiramate and antidepressants. Here is the ANSRIs. Then they went to Mayo Clinic, more topiramate, more anti-epileptics. So I have seen that many of the neurology department doctors are presenting patients with anti-epileptics and or antidepressants, and or saying that, hey, you have migraines, and trying to manage the migraines. So here Botox is kind of a migraine type or refractory headache solution that will give you Botox. I remember that for my wife as well, when she had the uh, issue on one side of her face with continuous burning and twitching and Bell's palsy like things, her doctor simply said that this happens to some people, and when if it annoys you too much, come back and we will we'll inject Botox. So here is Botox, and as you can see, the patient is showing a continuous deterioration. More anti-epileptics, more Botox, and more antidepressants, and nothing, no solution. You can see here the patient shows themselves going below the health line that they have created as a baseline. And currently they say in bed. So going back to the discussions, the emails, that patient got connected to me. The communication continued, and in that communication, you have seen the FLCCC protocol. I had at that time whatever other things I had studied, I offered them to discuss with their doctor. One main thing that I thought was important was low dose naltrexone, if they can talk with the doctor to see if they believe it could be helpful. So they went back, started photobiomodulation, started some of the CoQ10 and other such things, felt little better, but still unable to resume normal daily functions. So then um, there was another communication where they said, Mark reached out and said, I so appreciate the time you took to share your knowledge and about the vaccine injury treatments. It's been a great lift to my spirits to learn the possibilities of healing. So I think the just this hope that there can be something done, that in itself is curative. It's healing. So we had some more discussion. Mark connected me with their family members as well so that they can communicate with me. And then they mentioned, this is also January, that I was started on 5 milligram of prednisolone, noticed some improvement, but dizziness is still there. Then, this is a very interesting email. This is January 31st. Mark sent me an email saying, Hi, Dr. Sayed. I had an appointment at Mayo Neurology yesterday for blood work, more Botox, etc. And they said that in this process, they discussed with their doctor that, what do you think about naltrexone? And the neurologist was not willing to prescribe it. And in general, he said there are no investigations for and no data for vaccine injury causing these symptoms, and also challenged the patient to say, do you have any evidence of what you're saying? So I presented, of course, Cool Beans here, they know that I've been working with acute COVID, long COVID vaccine injury studies, some good studies, some not so good studies, but we have been looking at these mechanisms and studies for years now. And so I quickly presented some of the links. And I have also noticed that if you share a video, for example, my video, to say, watch this, many doctors actually become offended. I have seen people just in general becoming offending to say, why would I listen to someone on YouTube? Why would I listen to a YouTube doctor? As if that is some kind of an insult. I believe that the newer educational phase that we are entering is audio visual. It's not going to be written or reading only. And in that process, doctors like me and other experts and anyone like me and you, just like in the past when the great philosophers used to be standing on a platform or on a stone and preach to the people sitting next to them, I think education is going to be through videos and audios and so on. So I of course believe in this, that's why I do it. So I did not share my videos so that I do not end up offending neurology department doctors in Mayo. So I shared various studies. I shared the patient outcomes and excerpts. So, and this doesn't mean that every doctor is that way. I was talking with a patient a few days ago who said that I had an injury, vaccine or COVID, I don't remember. And they said I took LDN video of mine to their doctor. and they were open-minded enough to look at the video, look at the studies, and they said, let's use it. And that patient called and said, hey, I'm feeling much better. So it's not necessary that every doctor does it, but this is a general common approach. So I sent them a number of studies. Then there are another 13 communications in February, where this is February 17, a day before my birthday. So then they reached out and they said, someone in our family has caught COVID. What is the risk of any relapse and so on? So we also discussed more recent discussions of nattokinase and others. Then in June 5, a few days ago, look at the email, June 5. Mark says, you've been most generous to share information and answer questions as I work through my vaccine injury. I hope it is okay to ask a few more questions, but in that process, they talk about LDN as well. And here is what they say, LDN, low dose naltrexone. I have been improving with LDN at 4.5 milligram per night. I'm now able to be up most of the day. My doctor at Mayo also agreed to give me a prescription, so it is covered by insurance. So again, at the end of the day, the doctor at Mayo probably, I am assuming, looked at those studies and evidences that we sent, felt that there is something to try, and tried LDN. And the patient, from bedridden in a closed room, darkened room, to most of the time up and about during the day. That is the difference. This one little tiny medicine. And of course, it was great. So I called them and had a good discussion today. And then something really interesting. So remember, Mark is an artist. And so artists, I strive to be an artist, but artists who are artists, and I believe he's a professor in a university of art, they make things that are impactful. And so I received this picture today. And so I received this email that said, one second, I just want to read the title from the email. The email said, thank you was the subject. And then underneath this picture, it said, a small gift of sunlight for you. Thanks, Mark. Sent from my iPhone. A small gift of sunlight for you. So when I saw this, it actually made a huge impact on me. A patient injured, possibly even now, this discussion that I'm doing, it is entirely possible that YouTube looks at this and says, you know what is he talking about? And give me another strike. I already have a strike. But there are patients who are going through this, do not know what is the right answer. Doctors have not read up enough or are not convinced enough to see what is the right answer. Fortunate for long COVID patients, so nowadays long COVID, I guess some vaccine injury is wrapped in that as well. They are still getting help. However, vaccine injury is a taboo at this time. And so for such patient, imagine the lack of hope, and imagine rekindling that hope, and then imagine the patient reaching a point of being up and about, and then sending this. Do you see that the hands are different? So it is actually two people capturing the sunlight together and sending that gift over. It really made an impact on me. So I thought I'll share this. And in this story, LDN, low dose naltrexone, if not for everyone, for many, it is useful. And you can see the protocols at FLCCC. You can watch my videos, and there are many various solutions available, and more solutions continue to be studied. But this is an important one. Now, in the wrapping up of this, I wanted to show you some resources. These are the links in the description as well. Although, so this is FLCCC, where the long story short videos are present. These long story short videos with Dr. Bean are also present on Rumble. This is my video about low dose naltrexone. Let's look at the date when I did it. This was done, low dose naltrexone. When was it done? Don't know, but 1 year ago. So February 2, 2022. February 2, 2022. So 1.5 years ago. Not a lot of views. 77,000 views is not a lot considering that there are so many patients of long COVID and vaccine injury. But I'm not complaining. What I'm saying is this is something that was done a long time ago, has not gotten enough visibility, but long COVID itself and the LDN itself are very important things. So whenever you get a chance to discuss with anyone, keep dropping the name for low dose naltrexone. Maybe somebody needs it. And then in the same vein, what I have done is I have put together this site. This site is entirely put together with the supporters' donations, and I named it Healthy Beans. And what I did was in the beginning, and when you go to Healthy Beans, it is still under construction. We don't have enough funds to kind of make massive changes to this WordPress template, but still we have a couple of people that are working on it. And what they are doing is the following. I'm requesting them, asking them to go through the YouTube videos and collect various categories of videos and put them together in the form of little courses. So there are two benefits to that. One, you have, for example, mitochondria related talks. All of those are here. Near infrared are here. Nitrokinase is here. Photobiomodulation is here. Methylene blue is here. Dandelions are here. So that is one. Then vitamin C and vitamin D talks are here. Myocarditis and heart issues, these talks are here. Long COVID and vaccine injury, all of those talks in one place are here. Berberine is here. COVID and vaccine discussions, all the benefits of the vaccines and the side effects of the vaccine, everything, whatever we talked throughout the years, that is here. Guest interviews in which there are, you can see Dr. Syed Heather, Dr. Fareed Jalali, Dr. Keith Berkowitz, Dr. Stephen Phillips, so on, Dr. Paul Marek, and many, many guests. So all of their interviews are in this one place. Spike protein and spike protein related, the structure of the spike protein, the function of the spike protein, how does it bind, what does it do with ACE2, the spike from the vaccine, the spike from the COVID infection, and all that. These are all here, 30 videos. Pharmacology and interventions like low dose naltrexone and other drugs and supplements. 58 of these lectures are here. Nasal sprays are here. And I'm working with the team members to continue to um, add more lectures here and continue to develop this site. My hope is, my vision is that this place, the Healthy Beans, becomes a place where the long COVID or vaccine injury and then diabetes and other such diseases and the related more modern approaches, not just traditional, more modern approaches are all placed here without becoming conspiratorial. This is very important for me to not bring it in a stage and a state where the content itself becomes he said, she said, and does not have evidence, or evidence is too weak, or evidence is fabricated. So that is the vision for this page. So you have the link to this. Then I also have link for the Raylan Eagle. Although when she joined me, people were really upset that she's talking about mindfulness, she's talking about relaxing, and here are biological issues, and you're saying there may be psychological needs too. I think both of those go hand in hand. So it is not that you can just cure everyone by psychological effects. And this is also not true that you can just cure everyone by some therapies. There needs to be a combination of both. And some people respond more with the mindfulness and less with the medical therapies. Some people respond more with medical therapies and less with mindfulness. So I believe it just depends person to person. Then at the end, I also have low dose naltrexone on drbeen.com. However, I kept this link near the end because to join this, you have to pay and become a member. But any times you pay for this, it helps support my work and my company. So if you would like to have access to drbeen.com, which I guess you will give me this, that I brought it up at the end and I showed you the free resources first. This drbeen.com, in the description of this video, there is a link for a very inexpensive access to all of these videos on drbeen.com. And to show you just a list of videos, this is a new library page. And if you see, here are videos that are all even I get amazed for how many videos. Some videos are repeated in here because they're part of various modules. For example, long COVID videos might actually belong, some of them in neurology and others. So there are some duplication in this list, but still this is a huge list. And in the nowadays, what we are working on is the 3D anatomy. So you can click on for example, let's say ankle joint, and apologies for these thumbnails, they're under construction, but here is the ankle joint. And then if you couldn't click on various parts of the ankle joint, you can go and see these anatomies as well. So the link is in the description, and all of these links are in the description as well. Sura says, can you put the link to the website here? These links are in the description of this video. So once I finish this video, the links are in the description of the video. So this is the discussion I wanted to do. The reason this is very important for me, that patients who are long COVID or vaccine injured, they at least know that there is a solution somewhere. Is that in LDN or fluvoxamine, or is that the uh, NAC and acetylcysteine, or is that vitamin D, or a combination, or um, reducing the stress that in turn reduces the cortisol produced and norepinephrine produced, or is that the photobiomodulation and methylene blue, is that the near infrared in the morning and evening in walk? There are possibilities. So the hope is the most important cure, because hope will bring you towards the things that might work, but hopelessness will not motivate you enough to go and find a therapy. So, this is the discussion. Please help whoever needs help. Drop some of these drugs' names for them to discuss with their doctors. Um, you might save someone, and that would be a great deed from you. So, with this, you can you can probably see that how touched I am with that um, sunlight's gift, and by two people putting their hands together to do it. That is a patient who's happy, and they want to let you know that I am grateful for this. So, anyways, um, have a nice day. I will not come online this evening. I have another lecture to do. If I find time, I might. Otherwise, I'll see you tomorrow. Thank you very much. Please like, subscribe, and share. And if you would like to support this work, there are links in the description. You can become member of Drbeen. You can buy me a coffee. You can become member of Substack or Patreon. And you can just stay here on YouTube, be a member of YouTube as well if you like. So John says that, do you know Dr. Joseph Colombo? No, I do not, John. Broken Forever says I missed it. Broken Forever, hopefully you can watch the replay. Andrew says maybe you could try to cure the physics girl as well. I've heard about her situation. I felt that she is big enough. I know her, she has a big channel, that she would have help from someone, but happy to assist her if she needs to. Nathaniel says one day there'll be a medical school with a statue of Dr. Mubin, I guarantee it. Thank you. Jean says mechanistically, could LDN be of benefit during active COVID, as it has been beneficial for many years to lower inflammatory condition and used with MSME, CFS Lyme? Yes. So I think it may be even protective of long COVID-like outcomes if used during active COVID. So yes. Joanne says, my husband developed Guillain-Barré syndrome. From what they are saying was a flu shot. He's in recovery, 5 months on a walker, about a year from. See if you can talk with your doctor. Guillain-Barré syndrome and the myelination or the inflammation of the spinal cord could be autoimmune, where LDN may not be as protective, but because LDN does help with the neuroprotective protection, they may need to add this to the remaining whatever management process they have. Margaret says, thank you. You're very welcome. John says, thank you. You're very welcome. So with this, lots of sunlight is very important. Yes. Jean says, you're a light in the world. Thank you. Thank you very much. So with this, thank you very much. Have a great day. Stay hopeful and keep others who you know may be suffering. Keep them hopeful. There are solutions. Bye for now.